I will give the word now first to Patrick. Patrick is our finance officer and one of the founders of VAC4EU. He will tell us a little bit about the venue and about why we are here. And then I will give the word for the first founder's perspective presentation to Miriam Sturkenboom. And everybody knows she's professor in real-world evidence and head of the data science and biostatistics group at Julius Center in Utrecht at the University Medical Center Utrecht. Thank you so much for coming. I hope you enjoy the day. Very excited. Thank you so much.
Okay, is this working? Yeah, I'm sure you can hear me. Okay, so we are very pleased to welcome you here. It's my great pleasure to explain or to just inform you where you are exactly, because you're not all aware of what is this building. It was also a few years ago the occasion to, it's 2019, it's already 6 years old. We celebrate in the same room, we celebrate the end of the Advance project that was an IMR project at that time. And with Miriam, Vincent, and myself, we thought that it was a pity not to do something with what we have learned during these 5 years of the IMI project. And so we decided to do something with all this knowledge that was built, and we create in December 2019 VAC4EU was, and the official document were signed by the King of Belgium at that time. Now, a few words on where you are. The Academy of Science in Belgium was created in 1772, so you imagine it's roughly 300 years old. It was done by the Empress Marie Therese of Austria, who signed the first letter for the creation at the time of the Imperial and Royal Academy of Science. Academy of Brussels. That at the time, the Academy of Belgium was looking to what was done in the UK, and I'm sure that Debs will be pleased with that, because at that time, it's a few years ago, it's almost 300 years ago, the Belgium Academy at that time was looking to what was done at the Royal Society of London. And they were inspired by what was going on in London at that time, because the main idea of the Academy of Science in the UK, but I would say in all Academy of Science, and that should be clear in mind of everyone. This is what I was also trying to teach to my student a few years ago, is to develop the idea of contradictory discussion. Science is only possible if you are discussing what the people try to teach you. So the Academy of Brussels started with Literacy Society, mainly covering a lot of discipline of science. The next step was the creation of two classes, the classes of physics and of history. So the Academy is divided by classes. In 1794, the Academy stopped its activity under the French regime, as Belgium was under the French regime, and we had to wait 22 years before the Academy reborn under the Dutch regime in 1816. With the Belgian Revolution in 1830, the Academy changed its name and was called the Royal Academy of Belgium. At that time, other classes were added. So The Royal Academy of Medicines, as we are more concerned with this discipline, was created in 1841. And in that period of time, all the Rue Ducale, as you are, Ducale Street, all the Rue Ducale was rebuilt, and a lot of modifications were done to the main building outside. You can see the facade, they are all uniform, and this was done during the early 20th century. But inside of the building remains the neoclassic style of building. So finally, in 2009, not too far from now, the Royal Academy of Science, Letter and Fine Art, the total name of the academy, aggregate the different classes to create Le Collège of Belgium, the Collège de Belgique, under the sponsorship of Le Collège de France, with the idea to disseminate science to public through classes, through conference, through lectures, free lecture to the public. A first step of what we will call today open science. And one good example of that now, it's VAC4EU, as we can say that our goal is mainly to cover information regarding vaccine to the public. This said, I'm gonna just ask Miriam to take it over. Enjoy then.
Well, thank you very much, and it's a great pleasure to be here again. And it's also very nice to see so many familiar faces with whom we built VAC4EU, actually during the ADVANCE project. So it's my privilege to actually share with you a bit of the history from ADVANCE and how we got here and what we have been achieving in the past 5 years. So where did we come from? Because many of you that are new did not know the story, do not know the whole story. So I'm taking time to go in through that. So first of all, a picture from our other founder, Vincent Boschot, who actually is the reason why we are here, because he actually, after the H1N1 pandemic, went to the Innovative Medicines Initiative and asked for a project where we would actually work together as stakeholders. So he's the real initiator and tried to pull together the industry consortium to write this call proposal. And then how it works in IMI is that first the industry, in a two-stage, the industry writes this call text and a public consortium needs to apply. So thank you, Vincent, for having this great idea and making this happen. And I would like to have an applause for you. Now, what happened then is that actually when this call is out, you need to apply to a call. So here is a picture of, when we were that age, we were all much younger, you can see. But there was a team of people that were actually initiating the public consortium, and it was Jan Bonhoeffer from the Brighton collaboration at the time, myself, Eva, and also Carlos Diaz, at that moment working still at Synapse. And they were actually pulling off the consortium, the public consortium, to apply to this call text that was proposed from IMI. Now, the topic at that time was really to build an ecosystem where we could work together and generate reliable and transparent evidence. And the core thing was the collaboration between stakeholders, because if there was one lesson learned during the H1N1 pandemic, is that stakeholders didn't really communicate well together. And especially there was lack of communication between the industry partners and public health because of perceived conflicts of interest, so that was difficult at the time. And I think throughout the project in ADVANCE, we have been trying to overcome them and tried mutual understanding of one another, and actually also noted that it's good to speak together. So the ADVANCE project was born. It was kicking off in 2013. At that time, it got 5 million of cash funding by the European Commission and 5 million in kind from the FPA partners. We had a large consortium of 47 partners through 19 countries, and that is because we had many associate partners from the public health partnership. We had ECDC on board and the European Medicines Agency. So all these stakeholders together really allowed us to build the ecosystem, to design it and to test it. So thanks for all the parties that at that moment went through the advanced journey. So here you see the map of Europe, and in color code you see the type of organizations. And what you see is in many of the countries there was both a public partner, there was a public is in yellow, then the regulatory, then there was public health, there were academic partners, and there was industry. And having the combination within one country together really helped a lot also to build within country collaborations. Now, we had these work packages where we were doing the work, and I'm going to go through what we actually achieved. So what we tried to do is design a system, an ecosystem, and what we generated was readiness. Readiness for a next pandemic, potentially. And mind you, this was in 2013, and we ended in 2019. So we were just ready at the moment that it was needed. But we built readiness. And the first step, actually, led by the European Medicines Agency under the guidance of Xavier Kurz, who is also here today. Thank you, Xavier. There was an advanced code of conduct built, and the NCEP code of conduct was updated, taking a lot of lessons from this advanced code of conduct, where it was really described how, when we work together, we can even be scientifically independent. So that was a core piece of how we continue to work. Then there was also a guidance on governance. So how can you build a governance structure where you can actually work together, led by Laurence, and also this piece has been taken into account in the blueprint from Advance and the building of VAC4EU. Now, then we had great work done in the methods group, led by Katja Bollard. She's going to be here. I haven't seen her yet, but really inspiring partner to develop methodologies, together also with Vincent Bochot, who was really keen to have near real-time monitoring. But we built a lot of different methods to utilize electronic healthcare records and to create coverage estimates from dynamic populations, to do benefit risk monitoring, to look at misclassification and bias, and also component strategies under the guidance of Rosa. So what is a nice achievement is that there is a book, Vaccination Programs, which was made by the people working in this work package, very nice, from RVM, but also Paddy Farrington and Katja, and this book actually is now sponsored through CEPI, the Coalition for Epidemic Preparedness and Innovation, who makes it available so people can actually learn from this book. It's freely available. So then, of course, we had all these methods, and we also needed data readiness. So we had governance readiness, methods readiness, and data readiness is also an important component. What was done at that time is we had all the data sources that were participating. We were using a common data model, which is quite normal nowadays, but at the time we were using the Jerboa common data model, and we generated estimates that we could benchmark. And this is just like one example of estimates of pertussis vaccination, and we benchmarked the database coverage estimates with the WHO estimates so that we could see that they were complete, and they were. The same thing for incidence rates, comparisons to see how they differ between different countries, and that the data were fit for purpose. There were several tools built also to deal with the fact that data sources are heterogeneous in Europe, and that we need to both not only syntactically harmonize, but also semantically harmonize. So this was work done a lot by Benedict Becker, who is still working for VAC4EU, that created the code mapper, where we can translate between diagnostic codes, but also a vaccine ontology. Now, this is a busy slide. I'm not going to walk through all of this, but this was testing that the system that we built, the ecosystem that we built, could actually be utilized to calculate estimates of coverage, to do incidence rates of disease, to look at safety of vaccines, effectiveness of vaccines, and then also to integrate them in benefit risk monitoring. So this entire system was well tested, and all these papers were published across different data sources. So what we can conclude is that Advance really created the governance, data methods, and people readiness that was needed to build up VAC4EU. At the end of the project, we did write this paper where we really underlined that this collaboration is needed and should move forward. And this is how we acted, actually, also in the blueprint, which was written by the European Centers of Disease Control, so ECDC. So they came up with the blueprint, which is available from the website, and this is the governance structure that we still operate when we do studies, plus a stepwise process of activating study teams and conducting studies. So I want just to give you this legacy information because it has been the basis of how we have been operating in VAC4EU. So Advance ended in 2019. The consortium was unanimously voting to actually continue. We had long debates of what we should continue, what we should sustain, only the tools, only, you know, and we had metaphors like the kitchen. Should we have a whole kitchen going ahead or only the spoons and the forks and the cutlery? But we decided at the end that it was really needed to continue together and to establish an entity. Well, that was then signed by the King in December 2019 and then published in the Belgian Journal in January 2020. And then we had the tragic COVID-19 pandemic that was declared in 2020, but what was at least ready is that we could start acting at that moment. Not easily, but the components had been tested, so we knew how we should go ahead. So where are we now? VAC4EU is now a non-for-profit international association registered in Belgium. It's a pan-European collaborative network. And so the members of the association are organizations, and then all the people working in such organizations can actually participate in VAC4EU. Currently, we have 28 members. We have in 9 countries, and we have many that have actually access to data. The finance of the network is, we started out with membership fees. We still have membership fees, so it's important that this is a bottom-up sustained network. It doesn't need to rely on one project after the other, but it's really from the membership upward that it has been built. And there are now, there can be in-kind contributions from member organizations, but also overhead on studies that we are conducting and funding from funding entities. Now here you see from the start, we were with 3 founders. So that's Patrick Mahy that you just saw, Vincent Bochot, myself, and Eva was supporting the signature process at the notary. And has always been there and supporting VAC4EU. We have an executive board, which has now 8 members, and these are elected volunteers, so they spend their time voluntarily on the VAC4EU organization. And then we have a secretariat that is actually using personnel from different member organizations to organize and administer the association. We also have an established scientific advisory board. They are individuals that review our studies independently and provide advice, amongst which some old people were there, like that we know and were in the Advance network. And they, every time we have a report or protocol, they give us advice. These are the logos of all our member organizations, and I'm really proud that we have so many established European organizations that are working together to make this a reality in Europe. And it varies. We have small research organizations, we have academic organizations, we do have regulators that are member, pharmacovigilance centers. So we have many different flavors in our membership, and they each contribute their own piece. What makes the entity is not just its membership and the studies that we conduct, but also the working groups. So there are 4 working groups, and amongst each of the working groups, there are task forces. And this is where the member organizations come together to align and to build procedures and to create and see how we should be doing things together. Because, of course, when we acted in the COVID pandemic, we needed to act rapidly. And now the time is to really harmonize and to align. What VAC4EU is not just working with its members, but it also has collaborations with outside organizations which have similar purposes or goals. So here we see the Cittadinanza from Italy. So this is a citizens group where we have a memorandum of understanding to exchange. We work a lot with the EU Pharmacovigilance and Pharmacoepidemiology Network, research network led by Olaf Klungel. Thank you, Olaf, for joining here. We have been working on all the EMA framework and tendered studies that were related to COVID a lot. And VAC4EU was participating as a member of that network with a lot of other organizations as well. And so this is led out of Utrecht University. We work with UPATI, the patients organization, and Maria Duterte is with us today and will be in a panel. We work with the European Vaccine Initiative, the Global Vaccine Data Network, led by Steve Black from New Zealand, and they did global studies where VAC4EU is a member and participates as well. We participate in the INSYS network, which is doing specific investigations in the etiology and the genomics and omics of adverse events, led out of Canada. The Sigma Consortium, which is led by RTI in Pharmo and is working mostly with partners to do small molecule studies, so we work closely together on the methodologies. The SPEAC project, which is about safety harmonization, funded by the Coalition of Epidemic Preparedness and Innovation. And the project lead there is Rebecca Chandler, who we have here as well, and will come from that perspective. And we work together with the World Vaccine Conference. So this is what the entity is doing. Now, I want to share a bit on what we have been doing in the past 5 years. So clearly from a founder's perspective, but also being there and living through it, I can say we have been riding a strong wave. And sometimes it felt we would be swallowed in the wave somehow, but we went through it and we are here sitting and celebrating what we have achieved. So let's just look at the facts here. This is just the timeline. And from 2020, EMA was very rapid in actually calling for a project that would prepare Europe to monitor the vaccines. So this was prior to the launch of the vaccines. They asked for template protocols, they asked for background rates, and together with the EU PEPV network, we wrote the first project, which was Access, where VAC4EU participated, which did these background rates on adverse events of special interest, which had already been defined by the SPEAC project, and they were actually calculated across 10 data sources in 65 million people. So they were actually utilized both by the EMA for observed expected analysis, but were also available to all the vaccine manufacturers for their observed expected analysis. So we had all these Excel sheets, and they age and sex specific, and they could be utilized. That was 2020. Then in end of 2020, it became very clear that these vaccines were launched rapidly, and the first request for participation in post-authorization safety studies came in. So that was a very busy period, end of 2020, beginning of 2021, because then the request for both the early vaccine COVID monitor, which was from EMA to monitor the vaccines, as well as all the other past studies came in. And this is where VAC4EU could actually have, the beautiful thing of, distributing the work across partners, working together, utilizing the data and making this happen. So a lot of studies happened. The pass from Pfizer, J&J, AstraZeneca, Moderna, plus the EMA-funded studies that were monitoring the vaccines. Then in 2022, there was an effectiveness study called for by EMA that was COVE, led by the agency, the Spanish Medicines Agency. Then there was the global vaccine safety studies that started, funded by CDC. There were calls for natural history studies on myo and pericarditis, both for the mRNA vaccines. Then in 2023, there were the novel variants of the vaccines, both from Pfizer, was there the bivalent actually, and there were studies on small molecules for treatment of COVID-19, the Paxlovid studies that came in where VAC4EU supported, and everything in blue is still continuing, green is what is finished. 2024, safety VAC, this was a call from the EMA and ECDC to look at the feasibility of a vaccine monitoring platform in Europe, and we assessed the readiness and fit for purposeness of many of the data sources in Europe, and this was also delivered. And then 2025, we are moving on. We are moving out of most of the COVID studies, which have been wrapped up, and now are going into the new studies, which are dealing with RSV vaccine, both in older adults as well as in pregnancy. So you see that there is a lot of studies being done, ongoing, and a lot of collaborative work from all of the people here. Now, how did we manage this? Okay, so here it's just a summary of like knowing what we had built in advance and what we had tested, and we had somehow, so we had a code of conduct, we had a governance structure that was ready and incorporated. The membership was growing very rapidly after the closure event. We had a business development team that could act quickly from timid. And we had many teams from different organizations that were ready to step in and conduct studies together. So I think that's one of the biggest assets of this association. Now, we also had reusable tools. They were coming from Advance, but one of the things we did in VAC4EU is we actually chose to use another common data model. So we were not using the Jerboa common data model anymore, because that was like already predefined variables that we could not check how they were created, but we went to a common data model that we utilized from the IMI conception project, which is syntactically harmonized, so we would have a better view on the semantic harmonization. So we borrowed a lot, we could reuse a lot from other IMI projects, such as Conception. We also utilized the insight checks that were created, the level checks, the data quality, the catalog that was created and extended to electronic health records within Conception, the Molgenis software. There was a pregnancy algorithm developed that we could utilize for all of the pregnancy studies. There was a secure processing environment that we could utilize. There was the speak list of ASI, which was incredibly important, and the Brighton case definition for validation. So a lot of tools that we took from either Advance or Conception project that we could utilize to make this happen. There was a lot of data availability, and there is 180 million people. We aligned work instruction code list, so now thank you, Seema, for guiding the task force on the code list. We have more than 600 code lists that are harmonized across different terminologies, variable definitions, validation pipeline, a lot of different tools that we have available. We also have a training academy that we offer to all our members and their employees so that they can be trained properly. And there is rapid development of tools and R&D on the tools that we actually need. This is the pipeline we need. It's also on the website and in your brochure. We go through a 6-step process when we conduct studies, starting from syntactic harmonization. It means data are being put in the same common data model, a layer of semantic harmonization, study design, the statistical analysis, and subsequently meta-analysis and pooling, and then we have reports. So this is a systematic approach where programmers, statisticians, epidemiologists, the data expert and access providers and medical writers are all working together to make it happen. So this is the overview of the studies and the results. Very quickly, the EMA-funded studies through the framework program together with the EU PEV network. Background rates on 41 ASI from 10 countries. 8 template protocols written both for effectiveness as well as safety and benefit risk. Then the ECVM study, the early COVID vaccine monitoring study, did both cohort event monitoring, enrolling vaccinated persons really in the study and monitoring them, led by LAREP. So this included 117,000 vaccinated persons. Then we also did a comparative cohort study with background rates and post-vaccination rates in 4 countries very rapidly to monitor, and there already GBS and TTS were identified. Then we had the COVID vaccine monitoring study as a follow-up, which continued with the cohort event monitoring, also in special populations and for booster doses. And this, at the end, included more than 800,000 enrollees, mostly coming from Germany, where they had a lot of people enrolled. A lot of methods development on how to use self-controlled designs. We also did a rapid assessment of myocarditis signal, severity of COVID in pediatrics, and multi-system inflammatory syndrome. So those were all safety studies. Then there was the vaccine effectiveness of heterologous and homologous boosters after a primary dose, which showed clearly that heterologous schemes were more effective. Then safety VAC, and I've stated about that, but looking at fitness of purpose for the vaccine monitoring platform. And VAC4EU has, together with EUP-EPV, been helping out on different EMA-funded projects such as Consign, Adapt, and Target that are mostly small molecules or methodological, but where we provided tools. Now, these are these company-funded studies in one slide. Amazing work by many teams done on a large number of subjects, so don't underestimate the work that goes into having these numbers here. For Pfizer, the main PASS study has been delivered to EMA. There is no outcome yet, but looked at 5 interim reports. So these reports were 6 monthly, which was very tedious and a lot of work that was done. And the myocarditis, pericarditis studies have been delivered and accepted without comments from EMA. So that's a big success as well. Showing that the natural history or the prognosis of myocarditis after vaccination is not worse in, or is actually slightly better in those that have been vaccinated. For the Moderna, for Spikevax, there were many studies done. The main PASS study, a pregnancy study, plus also natural history study led by Aarhus and Julius Clinical. And also here, the study showed there were no new safety issues identified with the Spikevax vaccine. They could confirm the myocarditis after dose 2, but not in young men. And pregnancy did not show any negative association with any of the pregnancy or neonatal outcomes. The Janssen COVID vaccine study was conducted here. This was used in much less countries, so the study was smaller. It did show the association with GBS and TTS and several other risk elevations. Then the AstraZeneca study, also PASS, led by RTI, was also delivered and is online, available on the EMA HMA catalog, a 600-page report, I think even more, with all of the ASI done, different designs, cohort, self-controlled designs, many sensitivity analysis, having an active comparator, a historic comparator, contemporaneously non-exposed, and all of these analyses have been conducted and reported. So now there's the RSV studies and the HIPRA studies that are ongoing, and hopefully in the next 5 years, we will learn from them. There is a validation pipeline that we have established built on the Brighton definitions. So a structured process to align how we validate cases, and more than 5,000 cases have been validated by trained abstractors across many of the different sites. Now, not to forget, we have not only work that we do with our members for and then publish, but we also have webinars and a journal club organized for where also outside people can join. And this is the scientific fun, as Rosa calls it, where we discuss papers that are published, and our young investigators can comment on them and discuss. So everybody can join, so you're welcome to do that. So I'm wrapping up. From my co-founder perspective, and I'm only one of them, as you heard, Vincent and Patrick, I hope, I haven't spoken on behalf of you, but I'm certain you share the same sentiment. What we see is that we have established collaboration. We are able to generate regulatory proof evidence, as shown by many of our reports that have been accepted by EMA, FDA, and also MHRA. We have an evidence generation pipeline that is increasingly innovated and aligned and harmonized and made more efficient. And we have a very great community that we witness also here today and online. So I think what I can say is a dream that we had when we were founding this and signing it in the notary office in Belgium has come true. And I think the best way to have it come true is to live it through them, through all of these studies that we have done together. So I think now it's time to celebrate our 5th anniversary. I'm really grateful for everybody that has been helping so much to make this happen. And it's great to work together across all of the partners. I see many young people, even from Utrecht, that are part of this community now, that are here, and it's really nice to work together and to shape this together. So thanks a lot. And let's see what the day brings, and thank you.